Hello everyone. Today we will discuss about ECG standardization. So whenever it comes to ECG reading discussion, first thing which is discussed is about standardization of the ECG. So we will understand not only what is standardization, but also how those particular parameters are made as a standard parameters. The sub-segments will go like this. What are the already set up standards? Then how will be the ECG paper, ECG machine, how we got the timings and the speed, how is it standardized, what about the amplitude or voltages, and some expert utility of calibration of the ECG machine. These subheadings might appear boring, but once you watch this video completely, you will be able to understand the ECG practically. So let's begin. So if I ask you what are those standards which are already set in, we know that speed of the paper should be 25 mm per second and 1 millivolt of the signal generated at heart should give a spike of 10 mm. This is the standardization which we all know. So you might have observed in the ECG papers. So now we will understand how did we get these parameters. So for that we will focus on ECG paper. If you observe ECG paper, we can make out that in this paper there are grids kind of appearance where we can see these boxes. There are small boxes as well as large boxes. So we can see in one large box there are 5 small boxes, right, in a row if we consider. So the point here is there are small boxes which are of about 1 mm and there are large boxes which are 5 mm in size, which we can clearly make it here. In this picture we can clearly see that each small box is 1 mm and the complete large box is of 5 mm. As of now, don't focus on the timings, just understand they got a paper with some small and large boxes in it. So this is the idea about ECG paper. What they have done is they just connected an ECG machine to a person to record the voltages or to record the waveforms, how it will appear. So here we can see they connected ECG machine to a person and started recording the waveforms in the paper. They observed that there is a clear-cut pattern, like some waves are forming here, which are recurrent, like the pattern is getting repeated. So this thing they noticed first when they started recording the cardiac activity. So here they named them as P, Q, R, S and T. They noticed that this thing is getting repeated, right? So same repetition is happening at regular intervals. So then they labeled them as PQ, RST. So what they did was, probably these segments are indicating cardiac cycles. So that's why the format is repeating at regular intervals with the same pattern. So we know that one cardiac cycle will last for 0.8 seconds. This is the basics from physiology, right? So what they have done is PQRST, this segment is considered as cardiac cycle, one cardiac cycle. So this whole part segment is occurring over 0.8 seconds. This thing they observed first. So this was there in a normal person, in the sense a person with heart rate of about 75 beats per minute. Okay. So for that person, we know that every cardiac cycle will account for 0.8 seconds. This is the normal thing. So hope you got the point about the ECG machine and what they have observed at the initial days. They just connected machine to a person and noticed some waveforms, and these were in repeated mode. So they concluded that each of these segments will indicate cardiac cycle, and we know that cardiac cycle in a physiologically normal individual will last for 0.8 seconds. So they concluded that in a person with 75 beats per minute, that is physiologically totally normal individual, this PQRST segment or overall waveforms is giving a one cardiac cycle. So who was that person in this chart? It is here, right? 75 beats per minute individual whose recorded ECG was like this, PQRST. So overall, this whatever segment, right, it is repeating, it is till here and repeating again till here. Same thing is happening, right? So this segment, they concluded it as one cardiac cycle. So if we calculate here, suppose if we consider this is as a starting point, this as a ending point. So largely here 1, 2, 3 and this 4. Overall 4 boxes they noticed. 4 boxes they noticed in this person with 75 beats per minute for one cardiac cycle. That is 4 boxes for 0.8 seconds, right? So how much will be for one box now? One large box will be 0.2 seconds, right? 0.2 seconds. And here if we make it even smaller, that is one large box has 5 small boxes, right? So 5 small boxes is equal to 0.2 seconds. So one small box will be how much? We have to divide it. So it will come to 0.04 seconds, right? So this is the overall thing they observed in a person who is considered as physiologically normal, that is standard, with 75 beats per minute. So in that person, one cardiac cycle containing of PQRST was containing 4 boxes. So one cardiac cycle is 0.8 seconds. That's how they got that one large box is equal to 0.2 seconds. That is nothing but 200 milliseconds, right? This was the thing. And again, one small box was 0.04 second, that is 40 milliseconds. This is how they got the timing about the boxes. Hope you all got the point without any confusion. Now what about the speed? We have already told that for ECG to consider as standardized, it should be 25 mm per second, right? So at what speed paper should come out of the machine? That we will discuss now. So here speed in the sense it will be per unit time. It will be per unit. So at what speed paper should come out per second? Per second. This was the question. So now we know that, we already know that 0.8 second is equal to 4 large boxes. So 4 large boxes in the sense how much? It will be 20 mm, right? One large box, at the beginning only we discussed, it is 5 mm. So 4 large boxes will account for 20 mm. Now per second, that is for 1 second, which is 100 millisecond, it will be how much? 5 large boxes, right? This was 80 millisecond, 4 large boxes. 100 millisecond, 5 large boxes. 5 large boxes in the sense 25 mm. So what they got is, to get such standard things, the paper should come out of the machine at 25 mm per second speed. That's how they got the speed for standardization. Then what about the amplitude, that is voltage and amplitude? So for this, when they connected the leads to the chest wall and started recording the cardiac activity over the machine, it gave some spikes and falls, right? So whenever heart generates 1 millivolt of the electrical activity or electrical signal, it should give a spike of 10 mm. 10 mm. It is considered as standard. So you might have seen in ECG papers, at the left corners there will be a rectangular or square kind of waveform, right? So that will indicate, like you have to count it, it should be 10 mm. 10 mm. So that will indicate 1 millivolt of the signal generated at heart is giving a spike of 10 mm over the paper. This is considered as standard amplitude measure, right? So we got about the amplitude also. Now at the end, I have told you that there is some discussion about the expert utility. Just to summarize, one small box is equal to, like 1 mm is equal to 0.04 seconds. That is nothing but 40 milliseconds. We are just summarizing everything. One large box is equal to 5 mm or containing 5 small boxes. So in timing, it will come to 0.2 seconds, nothing but 200 milliseconds. And the speed of paper should be 25 mm per second. It should come out. Regarding amplitude, it should be like 1 millivolt should give a spike of 10 mm height. So these are the standard things in ECG. So what about the expert utility, which I am repeatedly telling? We can alter the calibers of ECG machine in some situations where we can utilize it to diagnose or to find out some abnormal conditions. For example, when it comes to speed, just imagine patient is having some tachyarrhythmia, right? Tachyarrhythmia. Here what happens? Paper is coming out, right? If you observe, paper is coming out at one particular speed, but the heart is generating signals very fast. That is tachycardia. So here sometimes we will not be able to find some particular abnormalities in the waves. For example, we will not be able to look for P waves properly, or Q wave will not be visible properly. So in such situations, what we have to do, we have to increase the speed of the paper. That is, you make it 50 millimeter per second. So how does it help? Just imagine paper is running on one side and the heart is racing on other side. So when there is tachycardia, this has increased. That's why it is affecting the waveforms on the paper. So meanwhile, you increase the speed of this side also. So when both are increased, the relative speed of the tachycardia will be lowered. By that way, we can find out all the waveforms properly. Hope you got the point. If two people are racing, one is going very fast, you just make the other individual also to run faster, so that the relative gap will lower down. This is the thing. So whenever there is tachyarrhythmia and you want to see the ECG properly, you can increase the speed of the paper. This is about speed. What about amplitude? We can double the amplitude. Double amplitude. That is, on the left side of the paper, ECG paper, I told that there will be a waveform, right, which will give 10 mm spike. So you just double it like this, giving 20 mm. So when does it require to be doubled? If we want to see Q waves which are hidden in the ECG waveform complex, especially when there is low voltage complexes. Low voltage complexes ECG is there, and we particularly want to focus on Q wave, like we are suspecting some pathological Q wave, but we are not able to see because of the low voltage complex. So just we have to double the amplitude standards. Then we will be able to visualize the Q waves properly. Similarly, we can half the amplitude. That is, this spike will be giving rise to 5 mm height. So when is it important? Again, to look for the waves properly, to visualize waves in case of very high amplitude, For example, in case of left ventricular hypertrophy, we often see a large spikes in the lateral leads, right? Like V4, V5, V6, we can see. So here, many of you might have observed, these will be like merging and will not be able to make out minor pathological changes. Even though it is significant, we will not be able to appreciate it much. So in that situation, you just reduce the height of these complexes by halving the amplitude of ECG standards. That's how we can utilize the calibers when we are doing ECG in a patient. Hope you all got the point about ECG standardization. It was in-depth discussion, but it will be very, very helpful if you understand the basics. So to summarize, in ECG standardization, we discussed about already set up standards. That is, paper should be 25 mm per second and 1 millivolt should give rise to 10 mm spike. And in the paper, there will be small boxes and large boxes. Small boxes will be of 1 mm and large boxes 5 mm. And when they recorded the ECG in a person with physiological heart rate, that is, if we consider very much standard, that will come to 75 beats per minute. What they got was some repeated forms of waves which they labeled as PQRST were forming. So such repetition, one repetition is considered as one cardiac cycle, that is nothing but 0.8 seconds. So from this, they got the timing about the ECG paper. So in the timing, they concluded that one small box will be 40 milliseconds and the large box will be 200 milliseconds. This is how they got the timing. Then about the speed, to get such waveforms, they fixed the speed at 25 mm per second. This we have discussed. Coming to the amplitude, it is nothing but the electrical waves generated by a heart. So 1 millivolt should give rise to 10 mm. So this we can see at the left hand corner of ECG paper. It should be 10 mm spike, that is considered as standard. Then finally, about the various practical situations where we can utilize or alter the calibers of ECG to find out waveforms which are not clearly visualized. Hope you have understood about ECG standardization. And regarding the reading of ECG, we have already made a video in detail, especially for the beginners. Meet in the next video. Till then, take care and study well.